Brendan, let's start with you on this. My belief is that, look, yes, we are all scared of Ebola, but in many ways, if we hadn't seen sort of some of these mistakes, it appears that happened in Dallas and also at the CDC, we might not be as frightened as we are now.
You know what's wrong? A couple weeks ago, people asked about it, and I said, you know what? We've got a good public health system. We surely do have a very good public health system. What I didn't get then is that the CDC is not designed to do logistics, and it's not designed to do medical care. They know about viruses. They're epidemiologists. They understand this. And what you saw in Dallas was that the CDC team came in, and like epidemiologists, they began tracking other people who might have been in contact, and meanwhile completely ignored a really crucial problem, which was getting nurses suited up in the proper way and protected. So the CDC is a limited organization that is struggling right now to handle a logistical problem that it's not supposed to handle.
The CDC made an assumption that America's hospitals, that any good hospital in the country would be prepared to deal with this, and they're not. That's what we found in this case in Dallas. Doctors Without Borders is, as Brendan found out sort of firsthand, America's hospitals are not. They don't have the equipment. They've had their budgets cut, and when hospital budgets are cut, the first thing to go has been disaster planning, drills, and biopreparedness.
Yeah. So, Brendan, you went to a CDC facility, right?
I did. So CDC right now is training people to go to West Africa. These are healthcare professionals, nurses and doctors who are volunteering, and what they've done is they've taken a Doctors Without Borders facility and recreated an Ebola treatment unit in Anniston, Alabama. What I learned
When was
there,
this?
This was yesterday.
Yesterday, okay.
Yeah. So what I learned there is that the Doctors Without Borders way of suiting up is a whole routine that you have to learn. You go in with a partner who checks you. You check your partner. If at any point you feel compromised, you both leave together. You walk in through the clean area of the room. You leave through the dirty area of the room so you don't get the clean area dirty again. You suit up. And the other thing is you're suiting up in a way that actually requires some learning and muscle memory to get the thing off. It's called a doffing procedure. It's the most complicated thing. So if you go to what the CDC has, they've got a PDF that you can download, and it'll show you some basic stuff. The Doctors Without Borders actually treats this. It's much more involved, and it's a routine, not just a suit.
And with the Dallas nurses, they had nothing like this. They had skin that was exposed. Yeah. In some cases, they were putting on...
I saw tape around wrists.
Yes, yeah. They were putting on tape. Some of them said the suits were too big, so they were putting on tape to try and secure them, put them in place. Yeah. Some of them were putting on multiple layers of gloves, which they thought would protect them more. However, it makes it more difficult to get them off. And in the process of getting all those gloves off, you risk getting some of that fluid that's contaminated on you.
And there's a clean technique to get the gloves off, too. And I mean, Shannon's right. Well, the most crucial thing is they didn't have protective boots, and all the fluids are on the floor. If you don't have boots, that's where you're most likely to be compromised.
Now, Shannon, Americans, though, who are not at ground zero here with Ebola, they're wondering, though, if I do get it, how can I be treated? What is out there?
So right now, we don't have any proven drugs or vaccines. We do have a few things in testing that may or may not be promising. One of the most promising things out there right now is a vaccine. And by January, hopefully we should have some data on some vaccines that could be used for health workers in Africa. GlaxoSmithKline is one of the furthest along on a vaccine. They hope to have about 10,000 doses that they could give to healthcare workers. And we know a lot about how to make vaccines. And this is not a virus that can't have that isn't vaccinable. This isn't like HIV. We believe we can develop a vaccine against this. Part of the issue is going to be being able to scale up enough vaccine to be able to vaccinate people on a widespread scale. So that's what's going on the vaccine front. On the drug front, a big question is, how do we test these drugs so we know whether or not they work and whether or not they're safe? You want to be able to give part of the people a placebo and part of the people and the other group a drug. So how do you do that in an outbreak like this, which is what the people are struggling with right now? So there's been supply issues, there's been issues about ethics that everyone's struggling with right now.